Welcome back to CTV Morning Live on our Ask the Expert segment with Watson's Pharmacy. 789-6559, extension 2803 is the number to call. Also leave us a message via Facebook, Twitter, and our email address. Right before we headed into the commercial break, we were hitting on the topic of shingles, and I want to get to that because, as it turns out, we have a caller that's calling in about that as well. What is shingles?
So shingles is a virus that happens when we're young, and then it lies dormant until a certain time when it can be reactivated by a stress, any kind of cold, flu. Just you see it happen in an older population above 50, and so it's called Zona, the virus. People might know it by that name, but some trigger happens, and then it just kind of comes out, and it happens. You can tell it's in a nerve because all of a sudden, in this straight line, you might see these red papules, and your skin in that area is incredibly painful. And so, best thing you can do is if that happens and you're like, oh gosh, this is very odd, talk to your doctor because there are some antiviral medicines that they can give to you right away. But in addition, there are some pain medicines designed specifically for that. Because
it can be incredibly painful. Almost, is it debilitating? That it's depending on where it is?
I've had one woman, she's had it this summer, and it has been so painful for the past 3 or 4 months. It's just incredible. One great thing is that there is a vaccine that's come out, and a couple years ago we talked about it. It's called Zostavax. It's developed by Merck Frost. It came out a couple years ago, and then it was not available, and it was really quite too bad because everybody was so excited about it. And so we had a backlog of about 300 people waiting to get this vaccine. But the good news is that it's available, and a lot of people are accessing that, and it's not 100% effective, but it certainly is effective in somewhere between 40 and 60% of the cases. It helps.
And cases can really vary from very light to incredibly severe, is that right?
That's right.
Now we're dealing with a caller right now. I do believe Brenda is on the line. Brenda, are you there? Oh, Brenda's on Facebook. Brenda's actually asking her question on Facebook. So let's take a look at the post right now. My 16-year-old nonverbal autistic son just finished his meds for shingles. He still has odd nerve pain and is constipated. So what are your thoughts on this? Thanks for your question, Brenda.
So sometimes they'll use some of these stronger anti-inflammatories or opiate-type pain relievers to help with this type of pain. That's not unusual, and those can, of course, cause constipation. So the best thing to do to treat the constipation is just lots of fluids, taking fiber. There's these little orange-red capsules called docusate sodium. You can get them, and they're called stool softeners, so they can be given throughout the day. They're very inert, so just about anybody can take them. But to help with the nerve pain, there's a couple items. The two that we spoke of here, the benfotiamine is an option. That's just a simple B vitamin. Most people can take that. This one, developed by the compounding pharmacist, is also very good. If it's just a slight area, it's not a big area, then just applying the cream to a little area seems to help a lot as well. The other one I always recommend too is magnesium, because magnesium is good for pain of all types, and so that's another option for this family as well.
Is there any aspect that it's itchy? Have I heard that it can be itchy as well?
It's itchy, but it's more painful. So it's more like a really, really painful itch is how it is.
Okay.
And if it's that neuropathic means that it's affecting the nerves, and it's like shooting pain. So it's almost like if you can picture you're holding onto an electric cord. That's the type of pain.
I think there might be some viewers at home that are going, no, it is really painful, that are experiencing this, and that I've heard that are literally taken over by it.
As a pharmacist, you're trying to help these people, and you just know it's gonna, hopefully we can just help them get through that period of time, and hopefully that period of time is as short as possible, but I just know that it can last a while. So I really do feel for these people affected.
Well, and there's ways, you're trying to improve it as much as possible. We do have another caller. We have a caller, I believe it's Christina on the phone. Is that right? Good morning.
Yeah, hi. Good morning.
What's your question?
Okay, I'm seeing a pain management doctor.
Okay.
And I have DDD along with fibromyalgia and 3 herniated discs.
Oh, gosh.
Oh, boy.
Now, he's got me on morphine.
Yeah.
And also, yesterday he started me on Sesamet, which is pot, I understand.
Not unusual, yeah. They use that quite a bit. It's a
okay,
very, very
I took one yesterday and slept the entire time. I couldn't do anything.
There
and
are
I
many
also have
doses.
like really bad irritable bowel syndrome. They thought it was celiac.
Okay.
And I take a lot of milk and magnesia.
Okay. Well,
So I'm wondering, like, how do I, for the bowel movements, how do I stay stable?
well, are you with the milk and magnesia now? That can help to produce diarrhea, or is that you're experiencing that?
Yeah, I can go 2 weeks without going.
Oh, so
Oh, wow.
so the milk and magnesia is a good idea. Absolutely. Once you're taking those stronger pain relievers, you really can become constipated, and that is a definite side effect of those. So, I mean, keep doing that. But I think you were talking about what type of magnesium might be good for pain, and this magnesium glycinate, again, is a very well-absorbed form of magnesium. The magnesium that you're taking is kind of designed to sit in the lumen of the stomach, or just in our stomach, and draw in water to help keep water in there to loosen up the stools and whatnot. So
To help flush it out.
that's right. But this one is more designed to get into the body to help with pain relief. So do talk to your doctor, or you could come into any pharmacy or my pharmacy, and we could talk about certain forms of magnesium that are better absorbed, that get into our blood, go to the tissues that are affected, and can help with pain relief.
Wow. Christina, best of luck listening to
And
that
best of
story.
luck.
My goodness,
Yes.
those are some tough days to get through for sure. So hopefully some of that information was able to help her out.
Yeah.
We're going to take a commercial break. I do also want to hit on the other two products that we have on the table as well. So we're going to be taking your questions for another segment. 789-6559, extension 2803 to get us in your phone call. We are on Facebook, Twitter, email as well. We'll be back right after this.